Good morning, and Premier King is here, and then I will give an update followed by the regular update by Marion. Around the world, there are now more than 13 million cases of COVID-19 and more than 573,000 deaths. In Canada, we have more than 108,000 cases and 8,790 deaths. Last week in Canada, there was a slight decline in the number of cases with a 13% decrease over that week. However, the incidence of COVID-19 continues to accelerate internationally, and the World Health Organization warns that we have not yet reached the peak of the pandemic. In fact, the World Health Organization reported the total number of cases doubled in the last 6 weeks. And on July 12th, a worldwide record of more than 230,000 cases was reported in a 24-hour period. We remain concerned about the prevalence of COVID-19 in the United States, with over 66,000 cases reported on July the 10th. There is one new case of COVID-19 to report today in Prince Edward Island. The case is an essential worker who had recent international travel. The gentleman is in his 30s and has been self-isolating since arriving in Prince Edward Island, and he has mild symptoms of COVID-19. The new case of COVID-19 is not related to the cluster we reported last week, and it is not related to the cases at the QEH that we announced yesterday. We currently have 9 active cases of COVID-19 in the province and 36 total cases since the pandemic began. All of the active cases are at home and are doing well and self-isolating, and there's no one in hospital. As I reported yesterday, there are 2 active cases associated with the situation at the Queen Elizabeth Hospital. Patients and staff who came into contact with the healthcare worker at the QEH emergency department have been called to arrange for testing. All those who came into contact between July the 4th and July the 10th, and those remaining patients who came into contact with the healthcare provider on July 11th are being contacted this morning. Yesterday, 506 tests were submitted to the lab, and all are negative. And that includes tests from staff, patients, as well as other tests that were done elsewhere in the province or for other reasons. This means that a majority of patients and staff involved in the situation at the Queen Elizabeth Hospital have been tested and are negative. Once the final results of testing of staff and patients are done, we will make that public. I'd like to thank everyone at the QEH, Public Health, the staff at the testing clinic and the QEH lab for their responsiveness and quick work in order to have all these tests and contact tracing done so quickly. I know some are wondering why essential healthcare workers and other essential workers are able to work without having to self-isolate after returning from travel. And since the onset of the pandemic, thousands of essential workers, including healthcare workers, have entered Prince Edward Island, and these workers range from healthcare to construction and manufacturing to aerospace to specialized equipment repair and maintenance workers. P.E.I. has exempted essential healthcare workers and other essential workers from the need to self-isolate for 14 days. But they do something called work isolate. So they work and they isolate when they are not at work, and they monitor for symptoms. Healthcare workers have one additional measure in that they are tested before going to work if they have traveled outside, at this point, outside the Atlantic bubble. And just to clarify, essential healthcare workers are required to work isolate, and when in work isolation, essential workers are to return home after they finish their shift and are not to be out in the community, such as restaurants and stores. The testing clinic at the Borden Clinic opened yesterday at noon, and the first day was successful with almost 40 essential workers tested. In terms of Operation Isolation, currently there are 883 households in self-isolation in P.E.I, and to date, 6,121 people have already completed self-isolation. And to note that since the pandemic began, over 10,400 calls have been received by the staff at the 1-800-HEALTH-COVID line. Also, since the pandemic began, 15,500 COVID-19 tests have been processed, including over 2,000 in the last week. In terms of enforcement, as of July 12th, Justice and Public Safety have issued 133 warnings to people, most for failing to self-isolate. And they have completed a total of 367 visits or compliance checks. 28 charges have been laid with fines starting at $1,000. 2 of the charges have been heard in provincial court recently. In both cases, the Crown was able to prove beyond a reasonable doubt the individuals left their residences or properties, and the courts upheld the charges. But many islanders and visitors have self-isolated exactly as required. But we have noticed an increase in the number of complaints about people who are not self-isolating, and we take these complaints seriously. As of July 13th, there have been 745 routine COVID-19 inspections conducted, with the majority being satisfactory. 18% or 133 were considered unsatisfactory, and most of the issues were related to not having an operational plan or following an operational plan, and most issues are resolved upon a follow-up inspection. Since the Atlantic bubble started on July 3rd, a total of 18,417 vehicles have traveled to P.E.I, and that's about 38,000 individuals since the bubble started. And overall, the Atlantic bubble is going well, with most people completing the online declaration in advance, making for a more efficient process at the point of entry. The events of the last 10 days remind us that COVID-19 continues to be in our province. We must remain cautious and protect against transmission of COVID-19. Our healthcare system, and more broadly, has responded well to the 2 recent outbreaks. We know we cannot avoid risk entirely, and we can take responsibility for our actions and take steps to protect ourselves and others. And we should use the tools at our disposal to really fight back and protect against COVID-19, and they are the ones we talk about all the time. Wearing a face mask or covering when enclosed indoor spaces, keeping 6 feet separation from others, and washing our hands often, keeping our circle of contacts small, and staying home from work when we're not feeling well. And please call 811 if you have any COVID-19 symptoms. I mentioned masks or face coverings, and it is one tool to protect others from COVID-19. And even when wearing a mask, it is important to practice other public health measures, such as maintaining good hand hygiene as much as possible. I'd like to just take a moment and thank those involved in putting together a mosaic that was really inspirational, both for me and for my team. And thank you to so many who were involved in that mosaic. So, in conclusion, it's what we say, but some days we need to think about it more than others. Let's continue to look after each other. Let us be caring, let us be patient, and let us be kind. Thank you. Turn over to you, Marion.
Good morning, everyone. I'd like to start by saying how grateful I am to live in P.E.I. and work with such a committed and knowledgeable group of healthcare leaders and staff. The preparation and planning we've been doing all along is serving us well today. Health P.E.I., in cooperation with Dr. Morrison's office and the Joint Response Team, has continued testing of contacts, including any healthcare workers who may have had contact with the confirmed cases. These efforts are ongoing today, and if repeated tests are required, we're prepared to ensure that these happen. We have continuously followed the public health and infection prevention and control precautions in our hospitals and clinics, including the use of the correct personal protective equipment for all clinical settings. In collaboration with the Chief Public Health Office, we've made adjustments to our personal protective equipment protocols, specifically at the QEH. As Dr. Morrison mentioned yesterday, the QEH is now using enhanced personal protective equipment to help limit any risk of spread of this virus. Health P.E.I. has also begun requiring masks for patients in our emergency departments or our psychiatric urgent care centers. We're asking that everyone who goes to the emergency department or any of our health services to bring their own face covering or non-medical mask if you're able to wear them. Health P.E.I. does have a limited supply of non-medical masks, so by bringing your own mask to all your appointments or walk-in services such as the emergency department and other clinics, you're helping conserve our supply and keep yourself and others safe. I'd also like to note that visitor restrictions do remain in place today at the Queen Elizabeth Hospital. There's no visiting permitted with the exception of 2 designated visitors within labor and delivery, pediatrics, our intensive care, and our neonatal intensive care units. Patients at the end of life continue to be able to have up to 6 designated visitors permitted. Case-by-case exemptions to these restrictions may be made for compassionate reasons at this time. Anyone visiting the Queen Elizabeth Hospital must call ahead to the service area where your loved one is being cared for to facilitate a visit. Please note that patients who come to the QEH for clinics or appointments are still allowed to have a support person accompany them. We've been hearing from some people that there is now a new fear with regard to attending the QEH and the emergency department due to the COVID-19 cases recently. Please know that every step is being taken to keep everyone safe and stop the spread of this virus. We have strong screening procedures and personal protective equipment protocols in place. While we understand this concern, it's very important that if you're in an emergency, you need to visit the emergency department or call 911. Please also attend your medical appointments. These are necessary and required for you to maintain your health. We want to ensure that not only we can contain the spread of COVID-19, but that during this pandemic, the pandemic doesn't cause Islanders to get sicker because they don't seek out care when they need it. Thank you to all the staff and physicians who've been working so hard to complete the necessary testing and taking measures to ensure the safest, highest quality care possible is being provided. I also want to thank all Islanders for your support and attention to the recommendations from Dr. Morrison. A final note to just remember, attend your appointments, seek emergency care if needed, and bring your own mask if you can. Thank you.
Thank you.
Yeah. So I think we will now open the microphone up to questions from our friends in the media. So go ahead, please.
Stephanie Van Kempen, CBC. Hi, this question is for Dr. Morrison. We're wondering, given that the most recent cases are essential workers who've traveled either outside the province or the bubble, should the rules change around having them self-isolate when they come back?
So I think that's a really good question. So I think it's a balance of trying to make sure that we have our system functioning. For instance, we want our hospital to be able to be open to look after all of us. So it's important that there are essential healthcare workers available to work there. But one of the things that we would, for essential, in terms of essential healthcare workers, we're going to introduce increased testing. So not just a negative test before they start to work if they've come in from outside the bubble, but testing at 0, 3, and 7 days going forward. We have, for instance, the essential workers for including that are traveling on and off the island frequently, and difficult to ever complete a self-isolation period or be in Prince Edward Island without being self-isolating. That's why we're doing more testing for essential workers that are island residents coming on and off the island. So I think our preference always is that people self-isolate, but we know there are exceptions because we do need certain things to happen in Prince Edward Island, whether it is in agriculture industry or healthcare or some specialized manufacturing, et cetera. So I think it's a really good question. It's consistent, certainly, what we're doing here with what you're seeing both internationally and in other provinces. And when I think about essential workers, it's also why we have to talk about all the measures we put in place to try to keep everyone safe.
And Stephanie, it's Dennis. I would just add that as Dr. Morrison indicated in her initial brief today, that the positive case we have today has been in isolation.
Yes. Yeah, you're right.
Thank you. And
Yeah.
just to follow up, for people who may have had exposure and may have gotten a call from Health P.E.I. over the last 24 hours or have missed a call from Health P.E.I. saying they may have had exposure, they're waiting for a test result or waiting for a test, what direction are they being given? Should they self-isolate?
So as I mentioned, most patients, for instance, have been contacted, and some will be contacted today. Those that have had a voicemail message left for them are being re-contacted. And testing arrangements are being made for them, and they are certainly at this point being told to self-isolate if possible, is my understanding, until they get that negative test. But really, these are mainly asymptomatic people, and if they have had symptoms, they should have even been tested earlier. But we're hoping that almost all the testing will have been done yesterday or today.
Thank you.
Thanks.
François-Pierre Dussault, Radio-Canada.
Good afternoon to you all. Dr. Morrison, en français, est-ce que vous pourriez me dire essentiellement la question que ma collègue anglophone vient de vous poser, pour ce qui est des travailleurs essentiels, avec les cas qu'on connaît maintenant à l'hôpital, est-ce qu'il y a une réflexion qui a été entamée peut-être de votre côté pour changer les règles pour vous assurer que des travailleurs porteurs du virus ne retournent pas travailler à l'hôpital sans savoir qu'ils sont nécessairement atteints?
Bonjour. Alors, on est déjà en train de faire pour les travailleurs essentiels à l'hôpital, on fait déjà un test avant qu'ils commencent de travailler s'il vient dehors de la boule atlantique. Mais on va maintenant en faire les tests plus souvent. Alors, avant qu'ils arrivent au travail, et aussi à jour 3 et à jour 7. Je pense que ça va nous aider pour les travailleurs essentiels à l'hôpital dans le système santé.
Où est-ce que vous en êtes avec les tests pour les gens qui ont été en contact avec ce travailleur de la santé à l'hôpital, la centaine de patients, la centaine de collègues de travail? Où est-ce que vous en êtes avec les tests?
Il y avait à peu près 103 patients, et puis on a fait les contacts pour arranger les tests pour la majorité de ces patients, et on a aussi eu la majorité des patients ont eu les résultats qui sont négatifs à ce moment.
Merci.
Merci.
Alison Jenkins, The Guardian.
Hi there. I have a question about the nature of the travel that the yesterday's case, the essential worker, just the nature of the travel outside the bubble. Basically trying to get at, was he allowed to work isolate after, a personal vacation or whatnot outside the bubble, or what? What can you share about that?
Travel outside the Atlantic bubble, and even when it was within the Atlantic bubble, essential healthcare workers were asked to work isolate, regardless of the nature of their travel. I can share that this essential healthcare worker was not working in a healthcare setting when they were not in the province or in the 14 days prior to coming to or being in Prince Edward Island. So I can share that. And that work isolation, of course, is something that's not unique to essential healthcare workers. It's done for many other essential workers that we've, for instance, head into this province and over the last number of months.
Okay, thanks. And my next question is about the serology testing. What's the latest on serology testing? I know that there had been plans.
Absolutely. So, and you may have heard about some of the serology studies and research studies that have been going on across the country. And for instance, the Canadian Blood Services very publicly has started one, and that will include a component of island residents as part of that immunity study. And we have proposal in place that we're going through the process of here to do our own immunity study and as part of a research and test so many islanders for immunity. It has not started yet. We are in the process, and for obvious reasons, the last few days have meant that has not been our focus.
Yeah, probably not. Great.
Yeah.
Thanks very much.
You're welcome.
Carrie Campbell, CBC.
Thank you. Dr. Morrison, I just wondered, first of all, if you could tell us a little bit more about the case that you announced today, what type of essential worker this is, and where they had traveled from internationally.
Hi, Carrie. So we don't usually identify what kind of essential worker. It's a non-healthcare, except that to say it's non-healthcare. So it's a non-healthcare related essential worker. And we have been certainly giving descriptions of travel domestically or internationally. And so he traveled internationally.
Okay. I just wonder, given the concerns you stated about the outbreak as it currently exists in the United States, if you've given any consideration as to whether there should be perhaps different protocols in place for people arriving from different areas, just depending on sort of what the conditions are there.
So, Carrie, that's a great question because, and we're talking about that nationally as well. Are we going to look as this goes on at different isolation requirements, testing requirements for different parts of the world? And you're hearing about that from other countries as well. So that's part of a broader discussion, but it's a really good question. So from our point of view, our order is still about self-isolation, and essential workers, including our healthcare workers who are coming in internationally, they absolutely have to self-isolate for 14 days. They do not work for 14 days. So that is actually in the public health order.
Thank you.
Okay.
Alan Cochrane, Times and Transcript.
Yes, good morning, Dr. Morrison. It's Alan here from Moncton. I'm just wondering if you could just reiterate the number of vehicles and people that have traveled across the bridge to P.E.I. And I guess if your situation will change the way, in any way, how people move between New Brunswick and Prince Edward Island in the near future.
Hi, Alan. So since July 3rd, 18,417 vehicles have traveled to P.E.I., and that includes 15,572 at the bridge and 2,485 at the ferry. And that equates to about 38,000 individuals who've traveled to P.E.I. since the bubble started. And last weekend saw over 3,000 vehicles travel across the bridge. And I think regardless, Nova Scotia, New Brunswick, P.E.I., and Newfoundland, we all share that importance of public health measures. And you may see slight variations in some guidance, but the basics are very similar, and I think those are being echoed and reinforced in all our provinces. So in terms of travel, I think when we are at home or visiting those, watching for symptoms, being tested if you have symptoms, washing your hands, wearing a non-medical mask when you're in indoor spaces, physical distancing, those are important regardless of where we are in the Atlantic bubble. So I think those will continue, so I don't anticipate a change at this point in time. But Premier, you may want to comment.
Yeah, I wouldn't have much more to add to that other than, unscientifically about this time of year, when Dr. Morrison reads the number of 38,000 in a normal year that would not be COVID, it would be probably at least 10 times that, I'm guessing, or maybe more. So it is a trickle compared to what it was. And look, from the beginning of our conversations around Atlantic bubble till July 3rd until now, we've been letting the public health information dictate. And as Dr. Morrison says, as of today, we feel very comfortable with our ability to contain and to deal with the limited number of cases that are here, but we continue to reevaluate every day.
Okay, good.
No, sorry, go ahead, Alan.
No, I was just going to say thank you very much. Just what happens to people when they are crossing? Do they have to pass through, give their information and everything? I'm not sure exactly what the process is.
So I could speak for people coming onto Prince Edward Island. They have to fill out, if you are not an island resident, you have to fill out a self-declaration form. And that is what we have been doing since July the 3rd. And I mentioned that people have been filling that form out in advance. If possible, it's printed off so that it can be looked at and reviewed when you come across the bridge or at the ferry terminal. And so you are screened. There's highway safety involved, public health officials, and so that is part of the process. There's some screening that is actually done on the ferry, so to help be more efficient from a traffic point of view, getting off the ferry. So that is what we're expecting visitors to Prince Edward Island to do.
Okay, thank you very much.
Thank you.
Thanks.
Rachel Collier, the Catholic.
Hi, can you hear me?
Yes.
Mm-hmm.
Great. So my question today is, since the Atlantic tourism bubble opened, how many people have been turned away at the island border? And I guess maybe if you have the information about, what way they were trying to enter, where, and why they would be turned away.
Rachel, I actually looked at that number just before I came in here, and I didn't bring it, but it's we have a total number of refusals, and that's at the airport and at at the bridge, for instance, and it's and some of the reasons, and we can certainly follow up and have that sent to you directly because it's on an email. I just don't want to give you an incorrect number, but I do have it available. That and the reasons for refusal would be that if they're coming from outside the Atlantic bubble and they don't have a pre-approval travel, because we still are expecting pre-approval travel through the different streams with the Office of Public Safety, and they need to be able to present that. So that would be the main reason for refusal. And remember, there's different streams. There's essential worker stream from outside the Atlantic bubble. There's family support and compassionate reasons. There are seasonals, residents. So there's a range of streams that, but they do need pre-approval travel if you're not coming in from the Atlantic bubble.
Okay. And has anybody been turned away, or have a number of people possibly been turned away because of symptoms, during screening of symptoms or of, contact with somebody who might need to be tested and so on? Or has that happened often, or?
The number has been very small, but there have been a few people who have screened in positive. So island residents who are coming back across, and this has been going on since the March, if they have any symptoms, then they are, we follow them up to arrange testing, and they are advised to go home, self-isolate, and then they're called in for testing the next day, depending on when they arrive.
Right, but has anybody been turned away for those reasons? Like maybe they're a tourist traveling, or they kind of, and they didn't think of maybe they'd come in contact with somebody or something like that.
So that's a good question. I'd have to check. It's through the different forms. So I'm not sure, but that is one of the screening questions on the forms, that if they've had contact with anyone or if they're sick, that is on our screening, as part of our screening questions. So, but I'd have to check in terms of refusals based on that.
Okay, all right. Well, thanks so much.
You're welcome.
Julien, le principal de cacheur, Radio-Canada.
Hi, good morning both. Bonjour Dr Morrison. Hier, vous étiez très inquiète concernant ce cas à l'hôpital Queen Elizabeth de Charlottetown. Aujourd'hui, vous n'annoncez pas de nouveaux cas en lien avec ce travailleur essentiel hier. Est-ce que tout d'abord vous êtes soulagé? Est-ce qu'on a évité le pire? Et est-ce qu'ensuite vous allez faire une deuxième vague de tests de ces mêmes personnes?
Alors, bonjour. Oui, j'étais tellement inquiète hier, et puis peut-être un peu moins parce qu'on a eu tellement de tests négatifs, mais je ne peux pas vraiment respirer très bien encore depuis jusqu'au temps qu'on a fait les tests de tout le monde. Pour quelques-unes des personnes, on va faire une deuxième vague de tests. Et puis, ça dépend si c'était au moins 7 jours entre le contact et le test. Un test suffit. Sinon, on fait un deuxième test au moins une semaine après le contact.
Pour faire un follow-up, Dr Morrison, la situation est bien sûr différente dans d'autres provinces au pays. Je pense notamment au Québec, qui a plus de 50 000 cas. Le Premier ministre François Legault a donné l'obligation de porter notamment des masques. Vous, depuis le début, vous expliquez que c'est fortement conseillé de porter ces masques, mais aucune obligation. Est-ce que vous, Dr Morrison, vous pourriez demander l'obligation dans les prochains jours ou semaines de porter des masques à l'intérieur de, que ce soit des magasins, des restaurants ou encore dans les transports publics?
Bonjour. Alors, on est en train de toujours de dire, si on a besoin, on va faire fait les masques obligatoires à l'intérieur. À ce moment, on n'est pas là, mais si on a besoin, on va changer vraiment juste de conseiller jusqu'à l'obligation, mais on va voir et puis ça change de jour à jour.
Merci beaucoup.
Okay, and I'll just take a moment. I want to translate a couple of those questions. The question a couple of questions ago was about yesterday. I indicated I was very anxious about the situation at the Queen Elizabeth Hospital, and was I feeling any better about it today? And absolutely, I think we all were anxious about the situation at the hospital yesterday, shared by Marion and the Premier. A little bit less anxious today as we have had so many negative test results come in, but I will only be after all the negative tests from everyone come in that I can that we can start to breathe a collective complete sigh of relief. And so I think and the other part of that question was, do we do a second wave of tests? So any tests, anybody who had a contact with a healthcare worker 7 days ago, and they will just need one test, but if people who had contact with the healthcare worker maybe 3 days ago, they may need a second test at around 7 or 8 days. So there will be, and that would apply to staff as well. And so there will be a second grouping of testing for those who will require it. So that was the second part. And the other question as well that to translate was around masks. In Quebec, for instance, they've come out and made it mandatory, following suit of other places for mandatory mask use in indoor places. At this point in time, it is a strong recommendation. I've talked about it here as an expectation for wearing non-medical masks in indoor places where you're but recognizing there are some people who cannot wear masks, for instance, some medical reasons. At this point in time, we have not made it mandatory in this province, but it is something we will continue to consider, and if we need to, we will change that recommendation to having it mandatory, but at this point, it is not.
Thank you.
We'll now open it up to additional questions. Please go ahead.
Hi, Dr. Morrison. This is Stephanie Van Kampen with CBC again. Just wondering if you can give us the number of how many patients and staff are still waiting to be tested at the QEH and how many will need to be retested.
Oh, Stephanie, we're just trying to pull those numbers together. Of course, there were so many tests that went into the lab yesterday, so we're some of it is actually we're working with spreadsheets and paper and trying to put it all into the system. We we know all the tests, all the people who had been in contact from a patient point of view between July 4th and 10th, as I mentioned, have been contacted, and testing was arranged yesterday. So the majority of the patients have been tested, and we'll be confirming those numbers. The people who may have had contact with the healthcare worker on July 11th are being contacted today to arrange for testing, and that was also because we're giving an extra day to in terms of spacing between the contact and the testing. So I can't give you an exact number. There were just over 100 patients that were involved with the healthcare worker, and so the majority of those, and we expect hopefully all will be tested by the end of day, but and then we can break that down. It's and of course we're working really closely with the Queen Elizabeth Hospital, trying to make sure that the staff that were identified are being tested, and I think the testing is also trying to be more inclusive than excluding anyone at this point in time.
Thank you. Just wondering also about the chain of infection. So do we know if the ER worker is the patient zero, so to speak, in relation to the Queen Elizabeth Hospital cluster?
I think, Stephanie, we mentioned this yesterday. It's difficult to know for sure, but we review the history of both the cases that had that link at the QEH in terms of potential exposures, and then we do testing of contacts. So we may never know for sure, but certainly we're doing all the right things right now in terms of doing the contact tracing and the testing, and we keep talking about trying to put our arms around these kind of situations.
Thank you.
You're welcome.
Hi, it's again. Oh.
Go ahead.
Non, vas-y.
Oui, bonjour, Dr. Morrison. J'avais une autre question pour vous. À la lumière des nouveaux cas qu'on a vus depuis les dernières semaines, allez-vous refaire un modèle de projection de ce à quoi pourrait ressembler la pandémie au cours des prochaines semaines, des prochains mois? Parce que le dernier modèle qu'on a vu, ça fait quand même plusieurs semaines, et on prévoyait peut-être une deuxième vague. Donc, je me demande quand est-ce qu'on pourrait voir un nouveau modèle de projection?
C'est une bonne question. Et vraiment, ces cas qui sont tout reliés, je ne pense pas change la projection comme un modèle, parce que on n'a pas l'indication qu'on a une grande transmission dans la communauté à ce moment. Alors, si on en a, on va refaire ces modèles, mais on est toujours en train de regarder les nombres et les chiffres. Alors, j'ai pas une date ou pas un plan spécifique pour en faire plus qu'on a déjà fait, mais on a un groupe de personnes qui en font les modèles, et puis on parle de qu'est-ce qui fait dans l'automne et avec l'anticipation d'une autre vague.
Merci.
Okay, merci. I'll just translate it as well. The question was around, based on the fact that we've had a number of cases in the last week or so, are we changing our projection models that we released a long time ago, or not a long time, but a number of weeks ago? And at this point in time, really these cluster of cases have not shown widespread community transmission, which would mean that we would want to go back and do some relooking at some of the modeling. But our modelers have a great team of people. We know that some of the focus is on the fall and what a second wave will mean and what that could mean for the healthcare system. But there's no anticipated time to release a new model just based on these last few cases.
Final question?
Hi, Campbell here, CBC.
Go ahead, Carrie.
Sorry. Hey?
Go ahead, Carrie, yeah.
Okay, thanks, guys. I just wondered, we have these new enhanced PPE protocols at the Queen Elizabeth Hospital. I'm just wondering why these weren't in place before. Is it because of the lack of equipment?
Do you want to take one?
Yeah, I can. No, it wasn't because of the lack of equipment. I think this is just an evolving situation, and as we see the risk potentially increase, we may add more safety measures. So that's really the discussion we've been having, and with Dr. Morrison and her team's direction on what else can we do to put in place safety precautions to contain any spread of the virus, that these are the types of things we consider each time a situation arises. So again, as I mentioned today, we're now requiring patients who come, if not medically contraindicated by age or medical condition, to wear a mask when they come to our emergency departments as well, to again further just help us contain any of that spread, protect our healthcare workers as well as other members of the public who are seeking care. So we're just moving forward with the evolving situation, and those precautions may change again when the risk level shifts, and we work closely with Dr. Morrison and her team on those precautions.
And so will that be at other ERs or just at the QEH? Like, why wouldn't it, if it's not in place at the other ERs, why not?
We are requiring the masking for the other ERs, but the risk at this point in time for the additional enhanced precautions is because we are going through that process of contacting and tracing all the contacts for these new most recent cases, that we want that added level of protection, and we want the public to know that this place, and the QEH in particular, is safe to come and receive care. People need the care that's provided at the Queen Elizabeth Hospital. We've added an even additional layer of protection to ensure that we're doing everything we possibly can. When we identified the increased level of risk was that we had a healthcare worker identified who worked in that department.
Thank you very much.
Heather, if you want to
Thank you.
A quick question again from Julien Legacha from Radio Canada. Question for you, Premier. This morning, the government of Newfoundland said that they don't want to go ahead, with an extension of the bubble to the rest of the Canada. For them, they don't want to see that happen. Maybe at the end of July, at least. What is your position on this, Premier? Do you think that it's too early, to expand the bubble, maybe mid-July, end of July? Do you have a schedule in your mind for this?
Thank you for the question, and it's one I answered yesterday, and actually in the legislature on Friday, it was a discussion I had with the leader of the opposition, and essentially what I said then and what I continue to say is I've talked only briefly with Dr. Morrison about expanding or talking about expanding beyond Atlantic. We had agreed at that time to not even really look very seriously at it until at least August 1st at the earliest. Dr. Morrison did say yesterday that events such as what we're dealing with at the QEH give us cause for even further pause. So I think we are comfortable right now with the Atlantic bubble. We remain very, very concerned about the Canadian-U.S. border and maintaining that, and that has been extended or will be extended until August 21st, I believe. So at this point, I would say, like my colleague, the Premier of Newfoundland, Premier Ball, that I don't think we would be actively looking beyond the Atlantic bubble anytime soon. Heather, is that pretty? Yeah.
No, I agree. I think what happens with the international border is going to be really key.
Yeah. So I hope that clarifies it. Yeah. Well, if there's nothing else, I want to thank our friends in the media. I want to thank Dr. Morrison and Nurse Dowling for their hard work, and we will chat again soon.
Hello?
Oh.
Hello?
Oh, were you gone?
Hello? Are you still there? Premier, still there?
We can be. Yeah, we're go ahead.
Okay. It's Alan Cochran again in Moncton. I had a really hard time hearing what you said, and I just wanted, at your last statement, I just want to make sure we got what is right. You're not actively looking to expand it, or
that's that's correct. We would be if we were to begin to look at expanding to, I guess what some people have called the Canadian bubble, we would be several weeks away from looking very seriously at that as it stands today.
Right. So you're not looking. So we're looking at beyond August, or?
We've been very careful not to put too many hard dates on any of these things because COVID is such a roller coaster. I
totally get it. Yeah.
Okay. So hope that clarifies it for you, Colin.
Well, it does. Yeah. I mean, because there was that statement yesterday, and we're all kind of wondering what's happening. So as a result of there are a few new cases here in P.E.I., you're not going to make changes to the bubble or slowdown on bringing people, allowing people into PEI?
Not at this time. I mean, as we said, we continue to evaluate the public health information on a daily basis. But we've been consistent from the beginning. If it's indicated that we need to do that, then we will do it, and we will do it quickly.
Yep. All right. Well, thank you so much. And of course, we always watch it here in Moncton. We know that lots of people come across that bridge and come straight over here to go shopping. So.
Well, I hope everyone does so safely. Thanks, Colin.
Okay. Thank you.